Hello and welcome to my video. This is Chet and I will be talking about fraudulent medical practices. So for our objectives, we will understand the nature, general effects of, and preventive measures against the use of fraudulent medical practices in society, and examine the responses to fraudulent medical practices in society. So as an overview for the background information, medical fraud involves intentional deception or misrepresentation by healthcare providers or individuals to gain unauthorized benefits, often resulting in financial loss and legal consequences. Common types include overbilling, adding extra costs, phantom treatments, falsification of records, fake online hospital or clinic profiles, and hospital deposit scams. So basically, overbilling means like adding more extra costs to the bill without the patient knowing. And phantom treatments means doing unnecessary services, adding more procedures or treatments to a patient that doesn't need it as an excuse to add more prices in their bill. So for its history, the practice of quackery dates back to the Middle Ages in Europe, but it became particularly prominent in the 17th and 18th century Britain amidst a growing public interest in science. The Renaissance and the Age of Enlightenment, with their emphasis on classical medical theories and evidence-based science, inadvertently provided quacks with opportunities to present their remedies as innovative and legitimate, challenging the established medical authorities of the time. and its and for its known effects on a person, the use of fraudulent medical practices can have severe and long-lasting consequences for individuals. These consequences can be seen in three primary areas: compromised patient care and adverse health outcomes, financial burdens on patients due to fraudulent billing, and emotional distress and trauma caused by healthcare fraud. So if a patient's health is overlooked or neglected, it could really lead to worse treatment instead of actually treating the patient correctly, and from the false scams and overbilling and stuff, they could lead the patient into debt, and they won't be able uh to have the money for the treatment. And because of the betrayal, the patient can't also trust any other medical medical services anymore, which could lead to more serious health risks. So as a societal response, for its overview, healthcare can take many forms, including billing practices, unnecessary medical procedures, kickback schemes, identity theft, and fraudulent prescriptions. So understanding these examples helps in recognizing various forms in healthcare fraud and their effects on society. So, as a reaction, individuals may feel emotional reactions such as anger, betrayal, shame, fear, guilt, and emotional distress or trauma after being deceived. Because of the fraudulent billing, they may be in debt or unable to pay for the real treatment now. So, as a response, the society should do four of these following. Number one, the government and legal response. This includes stricter regulation and enforcement, laws and penalties, and whistleblower protection. Whistleblower means to point out somebody who's doing bad things, like reporting it to the others that they're doing something bad. Number two, healthcare system response. Audits and transparency, professional accountability, and better record keeping. It is important to be transparent. It is important for the business or hospitals or clinics to be transparent with what they're doing, so that the people and patients there can know what they're actually doing, which could help build trust and make them more reliant on healthcare, because healthcare is a really uh, dangerous or risky field, especially when it comes to treating patients. So it's important to be professional at it and keep a better record on it, like a record on the treatment of the patients and the money they're paying, to ensure that that they are paying the right amount, and there won't be any other fraudulent medical practice inside it. And number 3, community and public response. This includes public education and awareness campaigns, patient advocacy groups, and media exposure. So it is important to educate yourself in these fraudulent acts, and discuss it with the other people, so that we could make awareness posts on social media. And if we get to reach, if these awareness posts reach to as many people as possible, there will be less victims on fraudulent medical practices. And lastly, number 4, individual response. This includes verification, reporting, and health literacy. So health literacy refers to acknowledging or understanding, analyzing the terms in health and stuff, so that you'll be able to see if the doctors actually doing their own thing, that they're doing it correctly, and if they're not diagnosing you with the wrong one and stuff. So it's important to verify, to double check if your doctor is actually legit, like the medicine you're taking, the services and stuff. And if you do detect these bad things, you should always report it immediately, so that they will take further action to the bad practices. So one example of fraudulent medical practice is the 27 plus million in cancer genomic testing Medicare fraud case. Daniel Hurt, who owned and or operated Fountain Health Services LLC, Verify Health, Landmark Diagnostics LLC, First Choice Laboratory LLC, and Sonoran Desert Pathology Associates LLC, was ordered to pay over 27 million for his involvement in a Medicare fraud scheme related to cancer genomic testing, or as known as CGX. The United States accused Hurt of working with others to trick Medicare beneficiaries into getting medically unnecessary CGX lab tests. So this is an example of phantom treatment, as they're performing unnecessary services or other practices that makes the patient believe that this is part of it, like they're doing necessary services, so that they could add more prices, more billing onto the original thing. So this is an example of how greedy these people are, because they're doing this to deceive and trick patients. And that is all for this video. Thank you for watching.